And we caught you getting ready.
That's right.
As the camera sort of shifted over. Dr. Alex Harrison joins us this morning, and today we are discussing irregular heartbeats. And I'm glad you're here for this because there has been many a time that all of a sudden I feel like this weird, I don't know, flutter feeling in my chest.
It's just love.
That could be, yeah. No, it could be. I have those feelings.
That's very common. Oftentimes, if you have an extra beat, you get a heightened sensation or a flutter, and it's usually almost always benign. And most people do have those, particularly depending on how much coffee you drank or how much sleep you got.
And you're right, it does happen around when I feel like sleep deprived or something.
Yes.
So it happens daily.
But last time I was here, we talked about stress, and then. I don't know if anybody watched that Michigan State Notre Dame game, but the coach there had some serious stress in that overtime, calling that gutsy field goal, and then had a heart attack that night. So.
Yeah. And stress can really, as you were pointing out, play a major role in it.
Right.
Now, that is something different.
Right. Today we were going to talk about the irregular heart rhythms, something called arrhythmias, the most common of which being atrial fibrillation. Something we haven't really talked about much here. And it's something that almost 10% of the people have once you are above 80 years of age. So George Bush Sr. had it. Many people have it. And it's not necessarily a dangerous condition, but the problems are potentially twofold. One is a risk of stroke, and the other is controlling the heart rate and symptoms that it can cause. So really the focus is on slowing the heart rate and on determining how high of a risk of stroke somebody has and determining how best to prevent that, either with aspirin or a stronger blood thinner called Coumadin.
Oh, Coumadin, right. Mm-hmm.
And so what I thought we'd show here is a graphic about atrial fibrillation. So the bottom there is a normal EKG. The upper chamber of the heart, called the atria, contract and generate a P wave, and that's the small little bump on the bottom there before the large spike called the QRS. And on the top rhythm, you have atrial fibrillation, where you're missing those P waves, and the atrial activity is chaotic and irregular, and the atria is, as it's described, fibrillating and quivering. And what happens is, when it doesn't squeeze blood efficiently towards the lower chamber of the heart, blood can pool and stagnate and form clots. And I have a graphic here demonstrating a clot within the heart, as shown here. This is a CAT scan that just demonstrates what I was trying to show, is that the LA is the left atrium there. That's the upper chamber of the heart that pumps blood to the left ventricle. And if a clot forms there, it can break loose and go to the left ventricle, get pumped to the body and cause a stroke, travel to the brain. It's very common cause of stroke in the elderly, and something we can prevent if the condition is known by the aspirin and or the Coumadin, depending on the risk.
Right. Aspirin's really become a major player in this sort of thing, right?
Well, aspirin is preventive. It affects the platelets to prevent clotting. It prevents heart attacks and strokes through a variety of mechanisms. In atrial fibrillation, it's really the low-risk patients we use it for. Coumadin is stronger, and if somebody, we look at many risk factors, their age, whether they have diabetes, hypertension, whether they have congestive heart failure, or if they've had a previous stroke. And you can get a point for any of those, the stroke being you get 2 points. And if you have 0 or 1 points, you're okay taking aspirin. The risk of stroke is minimal. And if you have 2 or more, it's strongly recommended that you take Coumadin.
Now, some of the causes for arterial fibrillation are included here, right?
Yes. So atrial fibrillation is a very common condition, the most common being heart disease, whether it be high blood pressure, lung disease, etc. But you can get it in younger patients who don't have heart disease, and that's generally when you have an infection. The thyroid can be overactive. There's actually a condition called holiday heart syndrome. So if you go out and imbibe too much alcohol for some
reason,
I
was just
reason
talking
or
about
another, the next morning, oftentimes when your body can have what's called a holiday heart syndrome, and the alterations in your dehydration and adrenaline levels can trigger atrial fibrillation. It generally resolves, but see that occasionally. Blood clots traveling to the lungs can trigger atrial fibrillation, as can an infection called pneumonia. Oftentimes after open heart surgery, atrial fibrillation is also quite common. So it's a very, very common condition. The biggest thing that patients notice is their heart is beating rapidly or irregularly. They have palpitations. So the focus there is medications to slow the heart rate, and then really the risk is whether or not they're at high risk for stroke and how best to prevent that.
Is this where pacemaker is used?
Pacemaker is used primarily for slow heart rate. Sometimes when people have atrial fibrillation, if the conduction system is diseased, it transmits the signal slowly to the lower chambers, the ventricles, and so the heart beats slowly, and you no longer beat rapidly, and you need a pacemaker.
All right, Dr. Harrison, thank you. And you saw the email there just a moment ago, which is morningrounds@kcoy.com. Thank you so much for that. And
yeah, so I guess this is my...
this is your... No, we'll have you back during, like, heart months and stuff like that.
Right,
so
yeah, I'll be
not
here
your
on
last time at the desk.
Special occasions, but it's been fun. It's been a good time in the last 6 months.
Right.
I hope... yeah.
Great, we'll be right back.